On behalf of our Cancer Center, I would like to thank you for being here tonight and for everything you do in the fight against this terrible disease. I deeply believe that cancer can be defeated when doctors, researchers, and philanthropists come together and work as a team. And the NBTI is a prime example of that approach. Thank you again, and we all are excited, inspired by your efforts, and look forward to working with you.
I'm involved with the NBTI because my father was diagnosed with a glioblastoma in 2009 and was treated here at Northwestern.
My exposure to brain tumors began in 1987 when my dad was diagnosed.
I'm affiliated with the NBTI because my husband, Jason Mogilner, was diagnosed with a brain tumor about 6 years ago.
My sister Marilyn was treated here at Northwestern Hospital. She passed away 5 years ago. Meryl was just a very fun, social person, a great listener, a great laugher. Weekends at the summer home was where we always were together as a family, and it was sort of a sacred place. You know, year after year, that's sort of the place where my family kind of gets together and sort of, you know, just wish she was still there.
He was the most generous, caring, compassionate, giving person. This is a perfect example of how the little things in life make such a big difference. And that's what he taught me. I mean, something as simple as a fresh fig was so exciting. I miss being able to pick up the phone and call him because we talk all the time on the phone. And even now, it's like if something good happens, I want to call him.
I miss his smile, I miss his laughter, the way he was a father. Incredible dad, loved his kids more than anything in the world. The NBTI plays a role in my life as feeling very connected to my late husband, and it makes me feel that I honor him. Sorry.
I mean, I'll always remember his laugh and his sense of humor. He loved to travel and loved to take us. As a geographer, it was, you know, maps and travel and exposure to cultures. I think about him every time I fire up Google Maps on my phone.
You know, brain tumors are one of those things when you hear about it, you're like, oh my God, how can anyone go through that? And that's what I used to think when Ferris would tell me stories about his dad and when he got diagnosed and when he was sick. And I would always think, my God, I can't imagine anyone going through that. And then I did go through that. And it's really scary. But somehow being here made it less scary because I felt that we were in good hands. I felt that the doctors really cared about my dad and his prognosis and making sure that he had the best quality of life possible and cared about us as people.
The MBTI started 6-7 years ago, trying to figure out how to better advance the care that we provide for the complex issue of brain tumors.
When I started here as a patient, this was a great group of fragmented doctors and oncologists and nurses and social workers, and over the last 10 years, they have formed the most dynamic community in brain tumor care across the globe.
The way to think of the BTI is a coalescence of the brightest minds in clinical medicine, translational research, and basic scientists. And we fuel each other.
All these things create in a sense, a network for people to access what they can't get at many of the other local and national hospitals.
This is a place that so many people need. So many people around the world, around the country, some local, some far. They need this place to live.
It allows them access to state-of-the-art care, therapeutic research trials, novel surgical and radiation techniques, but also importantly, it allows them access to our social worker, which can help with a lot of the home care needs that many of these patients need.
From Dr. Razor, who's become one of our really good friends, to our fellow board members who are all amazing, strong, compassionate, generous people. I mean, we feel really blessed.
I want to be connected. I want to be an advocate and pay some of that back for the team that kept us going emotionally.
It's been a remarkable experience to see the courage, the tenacity, the love, and the support that patients and their families display.
The MBTI and the doctors and social workers and nurses have saved my life. I've had 2 surgeries in the last 10 years, and without them, I wouldn't be here.
It doesn't remind me of the bad times or how difficult it was being here with my dad. To me, this is a place of hope, and it gave us extra time with my dad.
The treatment gets better and better, and anything that can be done to help future patients, we're very happy to and proud to support.
You feel like you're in this world by yourself with the experiences that you've had, but everyone is fighting for the same exact goal.
I have never seen a place come together like a community and an institute to form a world-class organization.
It's become more and more important for the Northwestern Brain Tumor Institute to depend on donations from patients, families, caregivers, friends of theirs, because all of the supporters help us do what we need to do.
We are the MBTI.
We are the MBTI.
We are the MBTI.
We are the MBTI.
We are the NBTI.
We are the MBTI.
We are the MBTI.
We are
the MBTI.
We are the
MBTI.
MBTI.
We are the MBTI.
We are the MBTI.